Say unto my soul, don't you worry, the Lord will make a way somehow.
I'm going to tell you a little about a weak craniotomy in a female patient that we performed recently. This patient had a brain tumor that was causing temporary arrest of her speech. We were able to perform this procedure successfully, done under mainly local anesthesia, whereby we were able to anesthetize the scalp nerves, and in so doing we were able to access the intracranial cavity where the tumor was located, and we were able to remove this tumor after while testing this patient's speech. She pretty much was able to speak to us while we were taking this tumor out. She was also singing while this was being done. The tumor was completely removed and she did very well after surgery. In fact, immediately after surgery, she was able to recall, past events, as well as her short-term memory is intact. She was up and about, walking around immediately after surgery on the following day, and she hasn't had any more events regarding her speech. Her speech is totally normal.
Why did you agree to that type of surgery?
Because of the seizure that I had on the 20th of May, I woke up about to 2 a.m. in the morning or 2 a.m. I don't really look at the time. And I feel my mouth numb, my tongue numb, and like something sticking in my face. And I was like, I'm shaking. So I lay down back. And like a voice said to me, get up off the bed. And I get up off the bed and stand and lean on the bed. I wanted to call my sister, but I couldn't talk. But I know everything going on around me. And I was scared to move because I said if I fall, there is nobody to take me up and I can't call. And I stayed there and I was shaking like this, shaking until the shaking moved, and then I opened my door, going the passage. And I was calling my sister, but the way I called her, I was like, ah, ah. And she said, Mary, and I said, ah, ah. And when I heard her open her door, I go back in my room and I sit on the bed, and she came in and she said to me, what happened? And I said, ah, ah. And I said, I don't know. But I was telling her I don't know, but not coming out. And then her son now, she sent her son to call my sister, and she go and call my brother. When they came now, my brother said to me, what happened? I said, ah. And he said, we have to take her to the hospital. My sister said, we're going to take her to St. Anne's Bay. My sister said, no, we are taking her to Pubic because that's where she's going to do her surgery. So I'm taking her there. And they bring me here. But before I reached the hospital, I was started talking again. And then now at 3:45, the seizure took me right here. And a nurse ran to me. And she was talking, and I was talking to her. And when I can talk, I said, this is the reason why I'm here. And then Dr. Cooke's come, because I was on his clinic before. And he came and he talked to me and he said, okay, we're going to do the surgery.
This is the first, to my knowledge, that this surgery has ever been done at KPH, the Kingston Public Hospital. It is not been a procedure that many of us rely on, because typically neurosurgical procedures are done and they last for 6 to 8 hours. So you need a skilled team of surgeon and anesthetists, as well as nurses, to be on board, and a very cooperative patient. In our case, we had a very cooperative patient, and she was able to tolerate the entire procedure without any problems.
So I just look at Dr. Cooke and just trust him, sir.
Because I was in his clinic for 2 months and 2 weeks.
Okay.
So I know he's a good doctor. So I trust him.
Okay.
And he said to me, Marjorie, you're going to be on one side for either 5 to 6 hours. What do you think about it? I said to him, what is good for me, I'm going to do. If it is going to take me 6 hours and 3 minutes, I'm going to leave here.
Okay. This is something that is the launching pad for us to go forward. We in neurosurgery find it important to operate on patients and cause little, if no, damage. So we do have a lot of cases that where whether it be tumors or otherwise that involve the speech area or areas that control movement of the hands or feet, and in order to get a real-time assessment of these functional areas, we can do it in patients that meet the criteria and are willing to undergo this procedure. And rather than waiting for the end of the surgery for us to find out that, you know, there is going to be there are deficits related to removal.
I wonder what I have done to make my way so hard to run. I say unto my soul, don't you worry, the Lord will make a way somehow. Yes, the Lord will make a way somehow. I kneel to the cross I bow. I say unto my soul, don't you worry, the Lord will make a way somehow.